Where's that presentation you need for your boss? Slack? Email? Drive? Lost, like your sanity, after wasting hours searching 76 tabs. Your work tools shouldn't take so much work. Dropbox Dash finds what you need fast across all your work apps, so you can focus on what matters. Spend less time searching, more time creating. Learn more at dropbox.com/dash.
Hey all, I'm Jamie Lynn Sigler, a mom, actor, and advocate. I know how overwhelming it can be trying to decide which treatment is right for you. I've been there. But you should know you're not alone. You can do this. Start with some research, talk to the community, and most importantly, don't be afraid to ask your doctor questions. You might find results that speak for themselves. That's how I landed on Kesimpta. Ask your doctor if Kesimpta, ofatumumab, could be right for you. You can check out the details at kesimpta.com.
Well, that's because you're an idiot.
Can you, shut up?
You see? Your stupid minds. Stupid!
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Bez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease. So I'm paging Dr. Steve. Dr. Steve.
From the world-famous Cardiff Electric Network studios in beautiful downtown OJ City, it's Weird Medicine. First and still only uncensored medical show in the history of broadcast radio. Now exclusively a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred to whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And back from sabbatical, it's Lady Diagnosis. Hello, Lady Diagnosis.
Hello, Dr. Steve.
This is a show for people who had never listened to a medical show on the radio or the internet. If you got a question you're embarrassed to take to your regular medical provider, or if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347.
Poohhead.
Follow us on Twitter at Weird Medicine and at Dr. Scott WM, and also at Lady Diagnosis. And visit our website, drsteve.com, for podcasts, medical news, and stuff you can buy. Most importantly, we're not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. All right, Dr. Scott. So let's go back to stuff.drsteve.com. You can buy Wet Rain, the card game, which is based on Presidents and Assholes. It's a fun party game. You will have fun playing this. Very soon, we will have DABBLEDICE. Second edition. We had a first edition DABBLEDICE.
Sold out.
Completely sold it out. But I had to get little plain dice, and then I got these stickers from overseas, and I had to put them on there, and it was a pain in the ass. So I made maybe 50
oh my God,
versions of it, and it sucked. I'd be watching TV and doing it, and if I fucked one up, it was like, God damn it, I had just the right number of stickers. That was stupid. So
dumb.
So I found a place that can. I bought a laser engraver, and I got Beck, my youngest, working on doing dice, and then I found a place that could do them cheaply. But anyway,
child labor.
Yeah,
he is over 18.
Well, he's 20, so soon to be 21. But so anyway, yeah, Roadie, stuff.drsteve.com. Check that out. Or if you want to see the actual website with the rules and all that stuff, go to. I got to come up with a better URL than this. It's dabblegames.myshopify.com. But if you just want to buy it, just go to stuff.drsteve.com. And check out Dr. Scott's website at simplyherbals.net, simplyherbals.net. You will get a Weird Medicine tchotchke if you will tell him that you're a Weird Medicine listener.
That is correct.
And
that
some
is.
dice.
And you're still going.
And many things. Yes, we're still going for now. Yep.
Okay, get closer to your mic, will
Chugging
you?
along. Yeah, we are chugging along.
Okay, and don't forget patreon.com/weirdmedicine, where you get all the exclusive content and things like our behind-the-scenes podcast recording that we do live at youtube.com/@weirdmedicine. It's not really a live stream. And then that goes over to Patreon, and then when I have time, I cut up segments for different questions that we do and put those on our YouTube channel.
Right on.
Thank God you only sleep 2 hours
and
a
not
night.
right, and not make money on anything. And then cameo.com/weirdmedicine if you want me to say fluid to your mama. Now, Lady Diagnosis, you've been complaining about fatigue, and we need to talk about that. And we also have a phone call from Ray DeVito that's very important that we get to.
Ooh,
so I hope
let's
he's
do
back
it.
in the chat room. We lost the questions from last time, unless you remember what they were.
I remember one of them.
Okay. All right. And so you want to do that first?
Sure, let's do that first.
Okay. Yeah, what do you got?
So we've got a question from somebody that I can't remember. But
McCribs.
McCribs, I guess is a diabetic, maybe former diabetic. He said he's got it in control now. That has a vitreous hemorrhage.
I know someone in the chat room said, former diabetic, how do you do that? You can actually become a former diabetic. I had several patients.
If it's type 2, yeah.
That had type 2 diabetes, which is the type of insulin resistance. They have insulin, but their body's not receiving the signal. And I've had several of those go on a very low carbohydrate diet and completely cure themselves. But it is difficult to do. It's possible. But anyway, that's what he was talking about. But now he had a vitreous hemorrhage?
Yep, that's correct.
So what was the question?
He was just wondering and his doctor's blaming it on his diabetes, and he was just wondering if that's always the case or if there were anything else.
Yeah, okay.
Some other potential causes.
No,
And he has
I
a
can
what?
tell
What's
him
his problem?
exactly what happened because it happened to me.
Let's tell Diane. What you had a question?
What was it he has?
Yeah, okay, so we're going to talk about it. It's a vitreous hemorrhage. It's bleeding into the vitreous humor, which is the gel-like, absolutely clear substance that fills the space between the lens and the retina of the eye. So your eyeball is filled. People think it's filled with water. It's really not. It's like Jell-O. You know,
very thick, yeah.
Yeah, and it's it has a gel matrix, and what happens is, every once in a while, and I think this is what happened to him. That jelly-like substance will start to shrink as you get older, and when it shrinks, it pulls away from the retina.
Right.
And it's a motherfucker when it happens, because I remember the moment it happened to me. I was looking at the sky, and all of a sudden, I saw floaters from hell just spinning around and all this stuff. And what was happening was the vitreous was detaching from my retina, and then it's fills in that space with basically water, hyperfiltrated blood. And it's clear as well, but then you have all these cells that have gotten pulled off, and they float around in there, and that's what causes floaters. And because they obstruct the rays of light as they come in, and then they project a shadow on your retina. And I had a million floaters all of a sudden, so I went and they did a CT of my eyeball, which they can do right in the retinologist, the retina specialist's office. And it showed that the vitreous, the gel had separated, and there was a thin layer of fluid between my retina and the vitreous now.
Gotcha.
And it was filled with floaters, just red blood cells and cells and stuff like that.
Do floaters go away?
Well, yes and no.
Yeah.
So
Okay.
what happened to me was they all settled to the bottom, which meant that I could see them at the top of my vision because everything's inverted, right? And then eventually they settled down, and now my brain is subtracting them out. So your brain will eventually go, okay, this spot is always there, so I'm going to subtract it out. improves
really
your
see it anymore.
It improves your vision, but it decreases your resolution. You know, the number of pixels that you can see. But he had a vitreous hemorrhage, so they had bleeding into the vitreous humor. That sucks because that is opaque. You know, blood is opaque. So it causes sudden, painless loss of vision, and then the appearance of floaters again. And it could be diabetic retinopathy, but he would have to have diabetic retinopathy. You can't just blame everything.
Right.
Again, assholes, colleagues who are assholes. Just because he had diabetes doesn't mean everything is caused by his fucking diabetes.
Couldn't agree more.
You can have a retinal tear, a posterior vitreous detachment like I had, that can actually rip a little capillary and cause bleeding. Could be trauma. Could be other things like vascular occlusions and stuff like that. So this person needs to go to an ophthalmologist that's doing more than just replacing lenses, cataracts.
Right.
I went to a guy once, and all he wanted to do was replace cataracts. So when I went to see him twice. The first time really pissed me off because I had a chalazion. A chalazion is where you get a fibrous sort of scar on your eyelid that's caused by a sty. So I had a sty, which is inflammation of these glands in the eyelid, and then when it settled down, it left this mass of fibrous tissue there called a chalazion. And I may have told this story before, but it's been a long time. So, and I had rotated under this guy, as a resident, right? When I did my ophthalmology rotation, we all got along. Everything was great. So I had just published my archery book, and I had a copy of it, a proof of it in my lap, right? And now he's flipping my eyelid upside down, inside out, and sticking a needle in it to numb it up, right?
Lord.
Now, any person having a needle stuck into their fucking eye is going to have a white knuckle thing, right?
Yeah.
Okay, so I had the white knuckle thing. Now this guy starts talking to me like I'm literally 5 years old. He's like, "Oh, are you the big archer?" Yes, you're the big archer, aren't you? And I'm like, shut the fuck up. Just stick the needle in my eye. So I guess he thought he was, I don't know what he thought he was doing. That he was soothing me in some way. It was unbelievably bizarre. Oh, yes, it's okay. I'm putting a needle in your eye. Are you the big archer? Yes, you are.
Sounds like porn almost.
Yeah, I know.
Oh, that's weird.
It was so fucking weird.
Did you punch him?
No, I couldn't. He had a needle in my eye.
Oh, my God.
I couldn't move. And I wanted to go, shut the fuck up, I'm fine. This is a normal reaction to having a needle stuck in your eye.
Holy mackerel.
Are you the big archer? Yes. Oh my God. So, there, again, assholes. When I say assholes, I'm talking to my colleagues who are not doing things the way they should be doing them. Treat people like human beings.
If only they knew who they were.
Don't
Do you think
object
they do?
to someone. They don't. The
That's
problem
sad.
is, so like, we have some issues with some physicians and the way that they talk to people. So I do a talk called Compassionate Communication, right? And I do it for the whole health system. Guess who doesn't show up?
The ones that need it.
Exactly. The ones that need it. So everybody else shows up. They already know how to do it. They're good. So anyway, all right.
Wow.
So
People suck.
so see an ophthalmologist, McRibs, and you may have to see a retinal specialist, particularly if the floaters are being caused by a retinal detachment. and in that case, a lot of times you'll see lightning strikes in the corner of your eye. If you see that, that's it. Now, we had a friend who's a comedian who had this, and so what they do for that is they'll put a bubble in your eyeball, and you have to lay with your face down so that the bubble, pushes up against the eyeball, against the retina, and actually plasters the retina back down. And you may have to do that for weeks.
Wow.
Lay like on one of your tables that you have where you have the hole for the face.
Yep.
Well, you just pull you don't have to sit up. Just pull it closer, because I want to be able to hear what you say. And I know what other people want to hear it too. There you go. No, you're fine. You're fine. Anyway, all right. So, so he needs to see somebody.
Yeah. He said he was going to find a second opinion, by the way.
If they offer a vitrectomy, be very careful for that. They should not offer that as a first choice. So a vitrectomy is where they take a big giant needle and suck out the vitreous humor, and then they replace it with saline. And everything's well and good unless one single bacteria gets in there, because it is wonderful culture medium inside the eye, and you will lose your eye. So I don't know. Would you look up, Dr. Scott, what the odds are that you will lose your eye if you have a vitrectomy because of infection?
Okay.
And Gemini will tell you the answer if you want. But anyway, all right. So that's a good one. We have another question over here. Oh, McRibs. Well, yeah, okay, he's saying, I had my second steroid shot. I believe they are blaming it on diabetes. Well, then steroids are the things they don't want to give. Now I'm looking for a second opinion. Oh, and then they told me I had cataracts. So my GP took a look and said, you have cataracts. Yes. Okay. Cataracts are only a problem if they cause, lots of people have cataracts, but they only are a problem if they obstruct your vision. So you will see, like if you're driving at night and there's halos on all the lights, the street lights, and it makes it so it's difficult for you to see the road, then you need to have your cataracts removed.
Right on.
McRib says, no detachment, but I was told the retina specialist. Oh, so you did see a retina specialist. Issue didn't happen overnight. A real ass clown. Okay, a vitrectomy has been discussed, but not yet. This has been a nightmare. I'm sorry. Just, you know what? Go to a university center and
get another opinion.
Get another opinion.
Right on.
I agree with that.
1 in 1,000
Poor
risk
little
of
McRibs.
losing your eye.
He's a good feller, that old McRibs. He surely is. Now, Waver said, hey, Dr. Steve, my fibula and me are doing good, just like you said. The crack healed in my fibula, just like a bruise. So good to see you and get your autograph outside of the bingo hall at the plaza.
Bingo.
We had, I dragged Liam to bingo, and he was like, I'm not playing fucking bingo. And I said, no, you have to do this because we're going to get yelled at by the school marm if we talk. And sure as hell, there's this lady that runs the bingo thing at the Plaza Hotel. It's all electronic. You don't have to do anything. And it is way fun. And the guy next to me won bingo like 5 times.
Oh, jeez.
And we, of course, Liam and I got nothing, but the school marm yelled at us again. Now, it's very difficult for people to hear if you're talking. And it's like, so no talking. We can't talk. It's funny.
This is serious stuff.
You have to play bingo at the Plaza. It's the most fun thing because it's so retrograde, And it's the only place where they are. And there's a woman on Love Island, UK named Tony, and she won. It was spoiler alert. She won Love Island, UK, so an American one. But she's from Las Vegas, and she says what she likes to do for fun is play bingo in Vegas, and she's the only place she's doing that is at the Plaza Hotel.
Oh, funny!
So I would love to see her there. She was oh boy, one of my dream women. But anyway. And she likes bingo, so she must be a good one.
There you go.
I like music bingo. That's fun.
Music bingo? What's that?
Where they play a song and there's a card and it has different names of songs and you have to guess which song it is first and then cross it off your card and get, 5 or 6 in a row.
That's it. Like they do that at Fusion. What's that called, though? It's called
know.
Slingo. Is it Slingo?
Maybe.
Singo.
Singo.
maybe.
That's
Yeah, it's called Singo.
maybe. But that's that's bingo-ish.
Yeah.
It's very bingo-ish.
I'm playing.
It takes more skill.
I'm playing Blinko tonight.
Oh, geez.
That's the Bristol version of Plinko,
Oh,
yeah.
my.
And but you can win like $1,500.
Ooh.
Yeah, you have to put the puck in just the right place.
You did that the last time.
Yeah, I didn't get to
And you
do
didn't
it. I didn't
win.
get right.
That's right. Oh,
I didn't
man.
get picked, but this time I'm going to get picked. That's tonight. So anyway, all right. Let's do the Ray DeVito thing. Come on, we gotta do Ray's voicemail.
All right,
So
Ray.
here.
What comes to mind when you picture the perfect roommate? One who comes when you call, one who doesn't forget to lock the doors, maybe one who doesn't steal your milk just a little bit at a time, hoping that you won't notice. At Apartments.com, they understand that when it comes to roommates, a pet can be your best bet. They're easygoing, they eat what you serve them, and they never clog the toilet. And that's why Apartments.com has the most pet-friendly rental listings on the internet. And with instant alerts, you'll know the moment that your perfect pet-friendly place becomes available. Apartments.com has so many features like 3D virtual tours, the ability to save your favorite apartments, and with over 1 million places to rent, you are absolutely going to find the right place for you. Apartments.com knows that moving can be stressful, but by giving you options, filtered searches, and more, they can help take away some of that stress. When I need a new apartment, I will definitely need a pet-friendly choice. So if you guys need a place that's pet-friendly and human-tolerant, check out Apartments.com, the place to find your pet-friendly place. Thanks, Apartments.com, for sponsoring the podcast.
Hey all, I'm Jamie Lynn Sigler, a mom, actor, and advocate. I know how overwhelming it can be trying to decide which treatment is right for you. I've been there. But you should know you're not alone. You can do this. Start with some research, talk to the community, and most importantly, don't be afraid to ask your doctor questions. You might find results that speak for themselves. That's how I landed on Kesimpta. Ask your doctor if Kesimpta, ofatumumab, could be right for you. You can check out the details at kesimpta.com.
Here we go. And Ray is a comedian. He didn't give us his plug. Ray, if you're in the chat room, what's your website and what gigs are you doing so we can plug it? I know only like 20 people are listening live, but we have a large group of people that listen to the podcast. So, all right.
Hello, Dr. Steve. How are you, buddy? It's,
Good, buddy.
It's Ray DeVito. You're a good friend.
Yes. I did. When we were at Hackamania 1, I was on Ray's show, and he said, "This is my health care." So he just asked me a million questions.
Oh,
about
nice.
stuff. It's like, Ray, you can call me anytime.
All right. So I was talking. I got my prostate exam yesterday.
Okay.
And what they did, they took ultrasound. They did blood work.
Okay.
So you know everything that they got to work with. They did blood work. Then they did an ultrasound on my stomach.
What?
And bladder before I urinated.
What?
Then they took my urine. Then they did another one afterwards.
Yeah.
And then that's when it gets tricky. So
okay,
Just measuring how much
this sounds like one of those
urine
lifestyle exams, because you ultrasound the bladder when it's full, because sound waves will travel through water and you can see the bladder pretty well. And then what they were looking at, they did it before and after, so you can measure the volume of the bladder when it's full, and then you have them piss, and then you see if there's residual. It's called post-void residual. And what you're looking for is, did they empty their bladder completely? If not, well, wow, am I 16? If not, then they will likely guess that the patient has an obstruction, that they're not emptying their bladder completely because their prostate is enlarged.
Boom.
But then they're charging for that.
Oh, yeah.
they had to take. They put some gel on my butt. I had to lean over to my side.
Yep.
And then they put
Do you have some music for this?
the camera wand.
No, you know what? If I played the sexy sax music, we get a copyright strike. So I'm gonna come up with my own sexy music. Yeah.
And they were trying to take pictures of it, but I just wasn't having it. I was just I mean, I was trying to let it happen. I mean, I know I needed the exam, but it just hurt a lot. It was
hurt. No.
And then apparently they have a smaller camera one, which I don't know why they just didn't lead off with that. But then they tried taking pictures with the smaller one, and still like nothing. The lady's like, "Yeah, we're not even like halfway where we need to be." So
but you have a really power. Yes, he has an unbelievably powerful anal sphincter. Right, he's Ray Tightbox.
Ray Tightbox DeVito. God bless him.
Oh,
he's one of those. I mean, he could be one of those guys that goes to for a colonoscopy and they have to use a children's.
Well, they can when they knock him out, he'll be fine.
He'll be fine. Yeah, I think some extra lube. He would have been probably.
Well, he told me that they lubed it up pretty good, but he just couldn't.
Can you tighten it up? I mean, like, can you clench it up?
Yeah.
Do you think that's what he was doing?
Well, clench yours right now. Do a Kegel.
I don't
it clenches.
know.
Yeah, you can clench it out. He has just got a really powerful anal sphincter.
Mm-hmm. Well,
because usually you can force your way through it. I mean, I've done 10,000 prostate exams. I've never had one I couldn't get my finger in.
Well, what they typically say is to squeeze your rectum and try to kind of pooch out, and then as you're, because you enter
push down like you're taking a shit, but don't actually take a shit, please.
Then you kind of enter the canal, and it's and as a general rule, that things kind of relax a little bit. But interesting.
Well, let's finish his call here.
People are saying something about a numbing cream that they should have.
Well, okay, the numbing cream doesn't work if they can't get it inside.
That's just going to be outside.
And then if your rectal sphincter is numb, then you're just going to be dropping loads everywhere. You'll be incontinent.
Give me a numbing cream, which they didn't. I don't know if that's normal or not.
No.
So what he did is he just did it with his finger.
He did it with his tongue.
I guess like felt around and.
Sorry.
Yeah, even that's uncomfortable.
So what they were trying to do, though, was get an ultrasound. So what I like about this is if Ray doesn't have symptoms, they're jacking up the cost. They're adding procedures that are really not necessary, in my opinion. Yeah. So they can't bill him for that ultrasound. So Ray, if you see that ultrasound on your bill, you got to say something because they didn't actually do it. They just shoved their finger up there and felt around, which is the old school way.
Old digital.
But they were trying to take pictures of it. Yeah. If you think that there's a tumor there or something, then the ultrasound thing is very helpful. You can see it.
Well, so is it, and for most people that are used to doing digital rectal exams, they can feel those.
Yeah.
Most tumors, not all. But, but if it's
I want to know if there's something wrong with my butt.
No, you just know it. If you go to prison and you just drop the soap all day long because nobody's going to be able to do anything to you. Yeah. That's awesome.
Going on inside there.
It's like a super.
Do not enter.
My body will not allow.
Abandon hope, all ye who enter here.
All that to happen, is that normal?
Yes.
Well, it made me now it makes me paranoid. How come my butt rejects anything?
Good.
From trying to go up there.
It's exit only, buddy. Exit only.
Yeah, it's not normal. No. So. The fact that they could get a finger up there meant that they could just force it. They didn't want to force a probe, but you have proprioception on your finger. In other words, you can feel your finger, and so you can force your finger in there safely because you know where it's going. But if you try to force a probe in it, all of a sudden it gives, you could perforate a bowel or something.
Ugh.
So they were trying to be careful. Yeah, and then they got more problems. But anyway, Ray, so what we'll do is Ray had more questions about this, so we will set up our phone call system again. I still have it. It's just that when Microsoft deleted Skype, I'm not sure how I'm supposed to get a hold of the call screening software anymore. But I'll have that set up, and this computer is
toast, baby.
Is toast.
Trash.
Those who are listening to the podcast and weren't in the chat room don't realize what happened, but the whole thing just shit the bed. So I have to finally get rid of it. Premium says, I go for 4 prostate exams a year because I like the feeling. Well, we used to have people that would show up at the emergency room, and we had a doctor named Dr. Bird, and it would say, they would always have patient states, and I've told this story, patient states hit on head by plastic Santa, and patient states almost hit by car, and sometimes they would say, patient states here for one of Dr. Bird's internal treatments. What the hell he was doing to him, I don't know. But yeah,
it didn't say that, did it really? Literally
yes.
said that?
Oh, yeah.
Oh, my gosh.
Wow.
Yep. So, premium.
Oh, my premium.
Yes. Yep. All right. Uh-oh.
It's great if insurance
is
covers
it me
it.
or is the stereo panning off? Uh-oh, hang on.
No, I think it's you.
No, it's you.
I think it's me because I was sitting too far away.
Yeah, we're good. Yeah, it was Dr. Scott.
Yeah,
Scott.
apologize.
All right, let's see. McRibs, Dr. Steve, one last question. Will you be appearing at WATP? No, I will not. I'm retired. But I will do Hackamania. We are working on something for Hackamania that's going to blow your mind. So as far as live gigs and stuff, I can barely get through this. I'm not spontaneously funny.
You're not
anymore, if I ever was. But it's hit or miss on these live gigs, and I don't want to ruin Carl's thing. If I was doing my own thing, like I liked doing Hackamania because I was doing Weird Medicine, and I was doing it with my delightful co-host Kaylee, aka Lucy Tidebox, and it was a blast. And we were in New York, in Las Vegas, and I can now say I headlined in Las Vegas because I was the last show at the Plaza. Yeah, I headlined in the Plaza Hotel, but I don't do that anymore. That kind of it's good for conversation.
Stop while you're ahead.
I'll do that, but yeah, I will come to the WATP events and stuff and hang out, but I'm not going to perform anymore for anything. I'm just retired. Okay, Diesel Child says, if I'm in a threesome with two ladies and we're engaging in ass play, and I'm going from one lady's fart box to the other fart box back and forth, have we completed a fecal transplant? Well, yes, to a certain degree. Yes, we have done so. So, yeah, that's an easy one. Yes, the answer is yes. Let's see here. Any other questions in the chat room? All right, let me. I'm going to do this, and I think this is what screwed us up before.
Oh no.
And but we'll see. As I'm going to check the super tips, and then we'll get out of here. All right.
Do it.
All right. Anyway, so Lady Diagnosis, anything interesting going on in your life?
Nope, nothing.
Everybody's digging the tank top, by the way.
Ooh, thank you.
Yeah. If you want to stretch your back or anything, you feel free. There you go. Excellent. All right.
She's a gamer.
Yep, the audio listeners are missing out. If you want to see what Lady Diagnosis is up to, then join our Patreon channel, patreon.com/weirdmedicine. And let me see here. So super tip, GG. Oh, see, it goes directly to Tukey. No, do mine. Okay, there we go. Stupid Tukey. All right, go to the dashboard. And do we have anything?
I don't think so.
No, we do. We do have Michio Kaku, though. So that's the kind of thing you can do at supertip.gg/Dr. Steve. All right. You about ready to get out of here?
Let's do it.
All right. Let's see here. I think we have one more question. Oh, yeah. Okay. We can do this in the time that
Hi, Dr. Steve. Can you talk about flash pulmonary edema? Can you tell us what it is? How do you get it?
Yeah. So, Dr. Scott, you want to talk about flash pulmonary edema?
Flash pulmonary edema.
You gotta look it up.
Pulmonary edema is an inflammation around the heart.
No! Boo!
Flash pulmonary.
No, it's okay. This is probably one for me.
Fluid in the lungs.
Correct.
Yeah. The pulmonary cavity. It could be coming from cirrhosis of the liver and the ascites leaching into the lung.
Well, but flash pulmonary edema is a different thing. So think of pulmonary edema as you've got a pump that's overprimed. So more blood is coming into the heart than it can pump out. And when that happens, it's going to back up into the lungs. Now, flash pulmonary edema happens when there's a sudden cause of this, and very often it's caused by decreased blood flow going to the tissues of the heart. So these people have congestive heart failure, and all of a sudden they have an incident. Either they've gained a lot of fluid, or all of a sudden the heart has said, okay, I'm not going to pump as much blood as I previously was because I've had an insult to my own blood flow. And so now all of a sudden the heart is not pumping blood out to the body, but blood is still coming in. It never stops coming in, and it backs up into the lungs, and they get flash pulmonary edema.
Okay.
It's a sudden onset within minutes or hours. It worsens rapidly. They get fluid in the alveoli of the lungs because of hydrostatic pressure.
Sure.
And they get shortness of breath, feeling of suffocation, decreased blood flow, decreased oxygen transmission into the body. And it's almost always a cardiovascular issue stemming from a heart problem. So if that happens, you'll have typical findings in the emergency room, including pink frothy sputum, and you'll have x-rays of the lungs that look typical, hazy, and you'll have decreased oxygenation. But you may also have increase in cardiac enzymes because the heart is now failing.
Okay, gotcha.
And they may diagnose you with a myocardial infarction or just coronary ischemia, in which case they'll give you oxygen, they'll give you nitroglycerin to improve blood flow. They'll adjust what we call preload and afterload, which is just taking the tension off the wall of the heart to allow the heart to beat more efficiently.
And probably something in front of fluids. But to be clear, you would have
and give you Lasix or another loop diuretic that will cause you to lose free water. So exactly.
But to be clear, chest pain, shortness of breath.
Yes, go to the
to the hospital.
Yep, exactly right. All right. Okie doke. Well, we still got 2 minutes on the outro music, but that's okay. Let me see if we've got anything else that we want to talk about. Oh, Premium says the lady's face is blocked. Thankfully, the most important features are visible, though.
Oh, that's not true. That's not true at all.
Poor lady diagnosis. Let me see what he's talking about. No, there you are. There's your face. She has a very delightful smile. And you can't see her hair. Yeah, right. She's got nothing on the ring finger. She's single, boys. But, okay, what are your criteria? You have 1 minute and 24 seconds.
They have to be smart and funny. And
okay, but that's not only it, though, because...
Well, they have to be tall.
There you go. So they got to be... Lady Diagnosis is quite tall. How tall are you?
I'm only 5'8".
What?
I'm only 5'8".
Okay, well, she likes guys that are taller than she is.
Yes.
Of course, I am 5'9", but it doesn't seem to make any difference.
What?
He's a big 5'9".
And I used to be 5'10", which is why getting old sucks.
He's a tall 5'9".
Stupid getting old.
All right, everybody.
Let's get out of here.
Yep. Thanks, Dr. Scott. Thanks, Lady Diagnosis. Thanks to everyone who's made this show happen over the years. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your ass, and get some exercise. We'll see you in 1 week, 10 days, for the next edition of Weird Medicine. And we will have Ray DeVito live, which will be fun. We'll record and at the appropriate time. All right? Thanks, everybody.
Thank you, guys.
See ya.